The Communications, Preparedness, and Response will be called to order. Good morning. First of all, I want to thank all the witnesses for being here with us. And as we examine the Department of Homeland Security's efforts to implement a national exercise program as required by the Post-Katrina Emergency Management Reform Act. Our nation needs to perform national emergency exercises in an effective and streamlined way, while at the same time fostering interagency coordination. The federal government, and specifically the Department of Homeland, should also serve as a resource for state, local, tribal agencies as they plan, as they conduct and evaluate exercises at the regional, state, and local levels. I look forward to hearing from Mr. Schrader as he discusses in details how these goals are being accomplished and how long it would take to fully implement the program. In addition, this hearing will provide us the opportunity to examine the effectiveness of top officials or the top-off exercises. This discussion will be in particular timely in light of Top-Off 4, which will occur later this month, I believe October 15th to the 24th of this year. Each Top-Off exercise involves a 2-year cycle of seminars, planning, events, and exercises culminating in a full-scale assessment of the nation's capacity to prevent, prepare for, respond to, and recover from terrorist attacks involving weapons of mass destruction. I would like to hear from our witnesses on how top-off exercises are coordinated across federal agencies and with the military, as well with the state and local governments. This committee continues to be concerned about the process of evaluating previous top-off exercises and the dissemination of lessons learned. In the past, DHS has told us they have been hesitant to provide a formal evaluation of top-off exercises because of the need to protect sensitive information about efforts to thwart terrorist activities. While we clearly understand the need to protect sensitive information after action reports outlining lessons learned need to be circulated as widely as possible. I'm also very interested in getting a perspective from Major General Saunders from the National Guard Bureau. And when it comes to exercising, nobody does it more effective, more thoroughly than our military and National Guard. I also believe we need to continue to examine the resources, the resource constraints the National Guard is under and whether that affects their ability to participate in emergency exercises. Finally, I look forward to hearing from Mr. Langenbach about his experience from a state perspective dealing with the Department of Homeland Security in Top-Off 3 back in 2003. In closing, I believe that when it comes to emergency preparedness and response, our goal shouldn't be for our federal, state, and local responders to learn on the job. They should have received the proper training, have a clear response plan in place, and have exercises planned extensively. While we're making progress, I think we still have a way to go. I want to thank, again, the witnesses for their testimony. The chair now recognizes the ranking member, Mr. Dent, of the subcommittee from the gentleman from Pennsylvania for an opening statement.
Thank you, Mr. Chairman. And today's hearing, I think, continues our oversight of the Department's implementation of the Post-Katrina Emergency Management Reform Act the last year. This community was instrumental in crafting that Act's provisions, including the establishment of a comprehensive national exercise program. The National Exercise Program, or NEP as we refer to it, is currently being established within FEMA's National Preparedness Division. I'm pleased that Dennis Schrader, who's the Deputy Administrator for National Preparedness, is here with us today to discuss the program. The NEP aims to provide strategic direction to national-level homeland security exercises and ensure interagency coordination. It's also to provide guidance to exercises conducted at the local, state, and regional levels and assist in after-action reviews and implementation of lessons learned. Homeland security exercises form a crucial component of the national effort to strengthen preparedness at all levels of government for acts of terrorism and natural disasters. We must not only ensure that our first responders are properly equipped and trained, but we must also ensure that they practice responding to events in realistic scenarios and test effectiveness and implementation of homeland security and incident management plans. Today's discussion is timely, given that later this month, Top-Off 4 will occur in Oregon, Arizona, and Guam. Top-off exercises are congressionally mandated full-scale exercises to test the nation's collective response to terrorist events. I did attend the top-off 3 exercise that occurred in New Jersey and Connecticut. I spent some time in the Rutherford area of New Jersey during that exercise and learned a great deal from it. So I do look forward to discussing top-off today and the new national exercise program with our witnesses, and in particular, I look forward to hearing how we can better facilitate accurate after-action reporting and the timely sharing of lessons learned from these exercises. I also look forward to discussing other ways we can maximize the benefits of exercises for participants at all levels of government, as well as for our nonprofit and private sector partners. I'd also greatly appreciate the time our witnesses are taking to be with us this morning, and so I look forward to receiving your testimony. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Den. Other members of the subcommittee are reminded that under the committee rules, opening statements may be submitted for the record. At this time, moving on to the testimony from the witnesses, I'd like to again welcome the panel of witnesses. Our first witness is Mr. Dennis Schrader, the Deputy Administrator for the National Preparedness Directorate in FEMA. His directorate is charged with overseeing the coordination and the development of the capabilities and tools necessary to prepare for natural and man-made disasters. Prior to the service at the Department of Homeland Security, Mr. Schrader was the director of the State of Maryland's Office of Homeland Security. Previously, Mr. Schrader spent 16 years at the University of Maryland Medical Center in a variety of leadership positions. Mr. Schrader began his professional career as a U.S. Navy Civil Engineer Corps officer, and he retired from the Navy with the rank of captain. Our second witness is Major General Stephen Saunders. Major General Saunders is a director of the Joint Doctrine, Training, and Force Development for the National Guard Bureau, a position he has held since October of 2004. His responsibilities include doctrine development, training, and exercise programs, education, professional development, readiness assessment for the National Guard, joint units, and operations. Major General Saunders' military career began as an enlisted soldier in 1972. In 1983, he joined the Army National Guard and has held a variety of distinguished assignments and received numerous awards and decorations for his service. Our third witness is James Langenbach, Operation Program Manager with the New Jersey Department of Health and Senior Services, where he's responsible for emergency management functions of the department. Mr. Langenbach participated in Top-Off 3 for the state of New Jersey. Prior to his service with the department, he was deputy chief and served 29 years with the New York, New Jersey Fire Department. Again, we are pleased to have all of you here with us, and without objections, the witnesses' full statements will be inserted in the record. And now I ask each witness to summarize his statement for 5 minutes, beginning with Mr. Schrader from the FEMA.
Thank you, Mr. Chairman, and Ranking Member Dent, and distinguished members of the subcommittee. It's a pleasure to appear before you today to discuss FEMA's National Exercise Program, including the top officials for full-scale exercise. As you know, Mr. Chairman, exercises provide Homeland Security officials an opportunity to practice critical prevention, protection, response, and recovery functions, evaluate the adequacy of existing capabilities, plans, policies, and procedures, and test coordination and working relationships before an actual incident occurs. At the same time, exercises and the lessons learned from them allow officials at all levels of government to be more effectively target their investments to continue to improve our national preparedness, including planning, training, and equipping our emergency response community. To better organize and synchronize the conduct of exercises across federal, state, local, tribal, and the private sectors, the Homeland Security Council, working with the Department of Homeland Security and FEMA, developed the National Exercise Program. The National Exercise Program provides a framework and assistive tools to ensure that federal, state, and local exercises lead to concrete improvements in policy plans and performance. The National Exercise Program unifies Homeland Security preparedness, exercise strategies, and links appropriate department and agency exercises to provide a single comprehensive exercise program. The National Exercise Program also uses a tiered system to differentiate the various types and sizes of exercises, ranging from Tier 1 national level exercises to other federal exercises under Tier 2 and 3 to Tier 4, which are the state, territorial, local, tribal, and private sector exercises. The Tier 1 national level exercises focus on government-wide strategy and policy such as administration, transition, training, domestic national disasters, national security, and domestic terrorism. For example, in the upcoming Top Off 4 exercise, approximately 15,000 federal, state, territorial, and local officials will participate in a robust, full-scale response to a multifaceted terrorist threat. Top Off 4 is organized around National Planning Scenario 11, the use of a radiological dispersal device. Top Off 4 will include the participation of all appropriate cabinet-level secretaries or their deputies and the activation of all necessary operations centers to accurately simulate a truly national response to a major terrorist incident. All 5 elements of the National Operations Center and the FEMA Region 9 and 10 Regional Response Coordination Centers will be activated. In addition, the FEMA emergency response teams and the federal incident response support teams will activate in each of the venues and will simulate the establishment of a joint field office in accordance with the latest National Response Framework guidance. Top Off 4 will test prevention, response, and recovery capabilities in 3 venues, Guam, Arizona, and Oregon, and across the federal, international, and private sectors. It will allow for the synchronization of national, federal, state, local, and private sector plans. It will test a common evaluation standard, and it will incorporate lessons learned, best practices, and corrective actions identified in previous top-off exercises. In addition to guiding the exercises themselves, the National Exercise Plan also includes 2 tools to enhance exercise planning at all levels. The Homeland Security Exercise and Evaluation Program provides a common language and concepts for designing, developing, conducting, and evaluating all national-level, federal, state, and local exercises. The HCEP takes a building block approach with each cycle of training and exercises, escalating in complexity, scale, and subject matter. Detailed guidelines, a website, and mobile training courses are also provided to help exercise planners implement HCEP. Once exercises are successfully planned and conducted, the Corrective Action Program provides a tool for systematically developing, prioritizing, tracking, and analyzing corrective actions for improving exercises. Essentially, the CAP provides a systematic means to prevent recurring problems and identify potential corrective actions and lessons learned. Best practices and other information resulting from the Corrective Action Program are broadly shared through the Lessons Learned information sharing tool that's online. The National Exercise Program, Mr. Chairman, is a work in progress. It will only succeed through an ongoing, diligent, and ever-improving contribution of all involved. Departments and agencies must continue to input exercise events into the National Exercise Schedule, continue to adhere to HCEP and CAP, and be proactive in providing material for the Lessons Learned system and fully fund their responsibilities within the National Exercise Program. To ensure that all partners fully understand their commitments under the program in advance, we're developing a 5-year exercise schedule. This schedule will enable participants to adequately plan and finance their National Exercise Program responsibilities. In addition, as required under the Post-Katrina Act, we are working to more systematically integrate the regional administrators into our exercises and other preparedness efforts. Future top-off exercises will focus on multiple FEMA regions, and we're working to identify other ways and available assets to enable the FEMA regions to more fully participate in exercise planning and coordination at all levels. The National Exercise Program structure and FEMA regional involvement will greatly enhance the coordination of exercise priorities across the entire federal government. At the same time, Mr. Chairman, a fully operational National Exercise Program will bring our nation one step closer to achieving a truly organized and unified preparedness exercise strategy. I look forward to working with you and the members of this subcommittee on these critical national preparedness initiatives. I would be happy now to answer any questions you or the members may have, sir.
Thank you, Mr. Schrader. As we move on to next witness, I certainly want to recognize the committee chairman, Mr. Chairman Thompson, for being here with us. I now recognize Major General Stephen Saunders with the National Guard to summarize his statement for 5 minutes.
Mr. Chairman, ranking members, and distinguished members of the committee, thank you for the opportunity to discuss Homeland Security exercises in preparation of domestic disasters, either natural or man-made. As you know, the National Guard has been actively participating in Homeland Security since the Revolutionary War, and it's always been the first military responders in times of need to natural disaster, civil disturbance, attacks on our homeland. The National Guard's success in performance of this historic dual mission, especially in the last several years, has increased the expectations for sustained and coordinated National Guard response to crisis at home. Starting in 2003, the Chief of the National Guard Bureau, Lieutenant General Stephen Blum, has acted aggressively to meet those expectations. With the support of Congress, the National Guard has created at least one weapons of mass destruction civil support team in every state and territory. We've built 17 chemical, biological, radiological, nuclear, and explosive device enhanced response force packages, each designed to aid in search and rescue, extraction and decontamination, and medical care in weapons of mass destruction incidents. And we built the Joint Incident Site Communication Capability, designed to enhance interoperability between military and civilian responders. Lieutenant General Blum also tasked my organization at the National Guard Bureau to provide education, training, and exercise support for these new capabilities. The centerpiece for that effort is our Vigilant Guard Regional Exercise Program, designed by the National Guard Bureau to train and enhance preparedness for our state-level joint task forces and Joint Force Headquarters. Each of our Vigilant Guard exercises is designed to involve multiple states, ideally all of the states in a FEMA region, beginning with an August 2005 exercise in Ohio at FEMA Region 5. We've conducted 7 such exercises so far. Subsequent exercises conducted in Kansas at FEMA Region 7, Texas in FEMA Region 5, Utah in FEMA Region 8, and last spring's exercise in Indiana, and more recently in Washington State, FEMA Region 10, and Virginia, FEMA Region 3. These exercises have grown from command post exercises concentrating on the Guard information management process to robust state and local full-scale play. Exercise conducted in Indiana last May is a good example, especially notable as it was the largest Homeland Security exercise conducted, and we linked one of our Vigilant Guard exercises to NORTHCOM's, Northern Command's, Ardent Sentry program, which included participation of personnel from the state of Indiana, Department of Homeland Security, FEMA Region 5, and the local responders from multiple counties. And we came together to execute the kind of multi-level, multi-jurisdictional exercise that we believe is the future of Homeland Security exercises. For future training, the National Guard Bureau is now building exportable exercises for the states based on the 15 national planning scenarios, and incidentally, I have a sample of the first 3 of those for the members if you'd like to have a copy of those. As a companion to our exercise program, we've also built a National Guard Lessons Learned program to capture and implement nationwide what we have learned at each of the regional exercises. As our exercise program has matured, we've made great progress in raising the level of knowledge and experience of both state National Guards and the National Incident Management System and the Incident Command Structure, as well as a National Response Framework. Also, we've increased integration with our partners in DHS and their Homeland Security Exercise and Evaluation Program with U.S. Northern Command and the Chairman of the Joint Chiefs of Staff Exercise Program. We commend the Department of Homeland Security for their work in building a foundation for future exercises. My staff has particularly been actively involved and working with DHS in developments on the Homeland Security Exercise and Evaluation Program, and its supporting HCEP online toolkits and implementation later this year. We look forward to that, the National Exercise Program. I personally see some exciting opportunities and synergies for future exercises involving the National Guard, where local and state civil authorities combine efforts with the federal and Title X military partners. And we're especially interested in their regional exercise program, which could connect civilian exercises with what we have been doing at the National Guard Bureau to increase our regional cooperation and integration of supporting capabilities. The biggest challenge that the National Guard has faced in achieving national exercise programs to be fully integrated with Department of Defense and interagency partners has been resourcing. Beginning with the President's budget request for fiscal 2008, Vigilant Guard exercise program will finally be funded in the DoD budget. This will cover only planning and design of exercises. The actual execution and state participation still comes out of different unfunded resource requirements. The National Guard remains committed to work inside the Department of Defense and Department of Homeland Security and the states in finding training opportunities to enhance our preparedness with capability afforded by present resources. On behalf of the Chief of the National Guard Bureau, Lieutenant General H. Stephen Blum, we commend your leadership and your attention on this important issue, and I look forward to your questions, sir.
Thank you, Major General Saunders, for your testimony. At this time, we recognize Mr. James Langenbach with the New Jersey Department of Health and Senior Services to summarize his statement for 5 minutes.
Thank you, Mr. Chairman, and thank you for the honor of coming here to testify in front of your committee. I'm here to discuss the Top Off 3 exercise and actions taken by the state of New Jersey to improve its security and emergency preparedness and its ability to respond to bioterrorism attacks and other emergency situations. Since T3, New Jersey has improved its preparedness posture through a statewide reorganization designed to provide a comprehensive, all-hazards approach to emergency management. Through the establishment of the Office of Homeland Security and Preparedness by Governor Corzine in March of 2006, New Jersey has taken a new direction in Homeland Security, which has resulted in improved cooperation with other federal, state, and local agencies and a change in the way the state approaches preparedness. Governor Corzine has also pledged significant resources to emergency preparedness, training, education, and exercises, as well as to studies and evaluations. Towards that end, the state is committed to supporting a robust exercise program. I'd like to take the next few moments to describe how T3 played out in the state and how we participated in the planning process, what lessons we learned, and how we plan to remediate shortfalls which were uncovered during T3. On April 4th through 8th, 2005, New Jersey joined Connecticut, Canada, Great Britain in what was then the largest counterterrorism exercise ever conducted. Just a quick overview. On Saturday, April 2nd, 3 sport utility vehicles departed a fictitious bio laboratory in New Jersey, driven by members of a terrorist organization. These vehicles were targeting New York City. Their attack plan was interrupted and they released their agent in New Jersey. This resulted in an outbreak of pneumonic plague, which by Friday, April 8th, had spread to every corner of the state. 30,000 people had been infected and over 8,000 died. As you can imagine, the ramifications of this attack were horrific. Our healthcare delivery system was overwhelmed. The emergency management structure struggled to maintain essential services. The large number of fatalities taxed the ability of our medical examiner's office. Besides the human toll, the state suffered huge economic losses. The recovery period continued 6 months after the attack and beyond. At this time, Mr. Chairman, I'd like to highlight some of the planning activities that went into this exercise that I just described. In February of 2004, the New Jersey Domestic Security Preparedness Task Force endorsed a proposal by the Department of Health and Senior Services to participate in T3. The task force also approved any expenditures associated with the exercise. The state of New Jersey, in conjunction with the U.S. Department of Homeland Security, began the planning process 14 months prior to the full-scale exercise. In this effort, we were full partners with DHS and the contractors that were hired by DHS to support the exercise. We had the state developed 13 overarching goals. I won't take the time in the committee now to read these, but they are in my written testimony. But you can imagine they covered all the gamut of health care and emergency management. During the planning process, we had monthly meetings with DHS, the support contractors, and the state's planning team. These meetings were mirrored at the county and municipal level. So what we did at the state and federal level, we mirrored at the county and municipal level. Running parallel with the exercise planning effort, DHS sponsored a series of national seminars. These seminars, referred to as building block events, brought together nationally renowned experts in their fields along with their state counterparts to focus on topical areas related to the exercise, such as biological terrorism, chemical terrorism, public information, and a national response plan. In addition to these national seminars, each state could and did opt to conduct a state-level seminar for their locals. All the planning, the events, the exercise itself did not come without costs. As a participant, each state was required to provide funding for its share of the exercise expenses. A memorandum of agreement was negotiated between DHS and the state of New Jersey. In New Jersey's case, the state share came from multiple sources. Our Office of Domestic Preparedness grants, UASI funding, Centers for Disease Control and Prevention, and Health Resources and Services Administration all provided funding for the exercise. Our total budget was $964,000 and change. Evaluation. As with any exercise, the evaluation portion is every bit as important as the conduct of the exercise itself. This is the reason we conduct exercises, to expose our shortcomings in a simulated environment as opposed to during a real event. The evaluation of all the moving parts of T3 was a huge logistical challenge. Due to the scope of the exercise, every county, every hospital, every venue had data collectors on site to capture the actions of the participants in response to the scenario presented to them. These observations were collected, analyzed, and compared against existing plans, policies, and procedures. Again, running parallel with the federal effort, New Jersey developed an after-action report and a specific improvement action plan, which is being implemented at this time. I'm just about out of time here. Some of the things that we worked on, information management. We discovered gaps in our information sharing with the federal and state, with the federal partners during the exercise, to the point where some of our emergency management planners were operating in an information vacuum and decisions were made based on incomplete information. Since that time, we've stood up a Regional Operations Intelligence Center, which is staffed by state and federal partners and is designed to collect, analyze, and fuse intelligence into actionable information. Federal and state coordination. Again, Governor Corzine, when he created the Office of Homeland Security and Preparedness, tasked it with that specific process to coordinate our activities with the federal government. The last thing I would like to say, I have a couple things if I can. One of them was an extra added activity during T3 was Operation Exodus, where we tested the ability for the National Disaster Medical System to move patients out of New Jersey hospitals to free space up for the people that were infected with pneumonic plague. The lessons learned from this Operation Exodus were carried out during evacuations during Katrina and Rita. Finally, after action reporting. Reporting the results of an exercise is a tightrope that we in exercise design have to walk. If nothing else, our enemies have demonstrated their ability to learn from us, so any report that highlights shortfalls or gaps could and most likely would be exploited by them. That being said, there should be a way that we can take the lessons we learned from Top-Off and for that matter any exercise and benefit everyone. One method we in New Jersey have developed is the translation of the after-action and improvement action plans into best practices recommendations we share across the state. Once again, Mr. Chairman, thank you very much for the opportunity to provide this testimony. And also I'd like to thank you and Congressman Thompson for your commitment to ensure that our first responders are equipped to respond in times of emergency. At this time, I'd be glad to address any questions you or the committee membership may have.
I thank the witnesses for their testimony, all of them. I would like to remind each member that he or she will have 5 minutes to question the panel. I now recognize myself for questions. First set of questions go to Mr. Schrader. As you know, the stated goal of the leadership of the Department of Homeland Security was to complete a rewrite of the National Response Plan by June 1st of 2007. As you know, the draft of the National Response Framework was not released for comments until September 10th of 2007. Will the state and will the federal, state, and local officials be exercising on the new National Response Framework during Top-Off 4? And if not, do you believe it's somewhat counterproductive for us to be exercising on a plan that will soon be outdated?
Thank you, Mr. Chairman. The intent or the actual way we're doing this is the National Response Plan is in effect and continues to be in effect, and the exercise is designed based on the National Response Plan.
The new one?
No, the existing plan, which is because the framework has not been adopted because we're still in the comment period, and that'll go on here for another period of time. However, having said that, much of the information that's in the National Response Plan regarding how operations would work within the Federal Emergency Support Function annexes, all of that still exists as an operational and is online in the National Response Framework. The framework, however, both the online documentation and the new document are still open for comment.
What's the cost to do this top-off exercise? roughly?
It's approximately $25 million to design and run the various components. And of course, it's a cycle, sir, in that it's been a 2-year period. So there have been a number of, a series since 2 years ago of design meetings, seminars. There was a command post exercise. There have been tabletop exercises with key deputies, all the deputies in the federal family. So there's been a number of activities, but that whole series of activities and the post-exercise activities will be about $25 million.
Right. Knowing that we're going to spend roughly $25 million on exercises or on a cycle, and knowing that, and I understand there's a deadline, I mean, there's a comment period right now. What's your response on spending $25 million, roughly $25 million on a plan that will soon be outdated?
Well, my sense is that, from what I know, having been at the state level and what's in the existing National Response Plan, the reason, let me back up a step. When the plan was originally released in 2004, the intent was to do an update in a year. Of course, we all know that a year later, Katrina happened, and that was pushed back because we wanted to incorporate the lessons learned from Katrina. So that process has been ongoing. But the fact of the matter is that the material that's the body of the NRP is in fundamentally in the National Response Framework. The issues that came out of the old plan from '04 was that it was too large in a paper binder. It was hard to read. It didn't have an executive summary framework. It didn't start with the premise that all disasters are local, so it's been rewritten for executive level understanding of how the process actually works. Now, there are other changes that are being debated and have been incorporated through work groups. There were 12 work groups that generated many comments, and there were 17 issues. So there's been a lot of work that's gone into it. But the fact of the matter is the existing National Response Plan that's in effect now does work. We're just looking to improve on it, but with the new framework.
Okay, well, I think we're going to follow up on that question.
Yes,
Let me
sir.
just ask the second
Yes, sir.
part of this. Our subcommittee just recently held a hearing on to examine the capabilities of first responders in border communities. What we learned was that local and state governments are exhausting their limited resources to avert and respond to any disaster on border communities. It's my understanding that international partners like Canada and Great Britain were involved in past top-off exercises. Two-part question. Again, what were the policy reasons for choosing Canada and Great Britain? And then the second part is, given our close proximity and mutual economic interest with our friends in Mexico and the Caribbean Basin, has the department considered extending the invitation to participate in this full-scale terrorism-based scenarios, especially, I know Canada was included, but especially with Mexico and concerns that we've been facing. So the two-part question, part A and part B.
Well, let me answer the first part and then beg your indulgence on the second part. The first part, there was outreach and there was a lot of volunteer activity in terms of folks coming forward to participate. What I would like to ask is if we could brief you offline because we'd have to bring some other people to the table to participate in that conversation, if I could ask your indulgence on that.
We'll do that, but I certainly want the members of the committee to know the reasons, the policy reasons. Yes. What about the second part?
That was the second part. Yeah, that was answered the second part. I'm sorry. That in order, regarding Mexico, if we could do that offline, I'd appreciate that.
We'll be happy to do that, but I would like to, when you set that up, I'll have the committee clerk, because I certainly want to have all the members of the committee that want to participate to hear the reasons
yes,
why.
sir. We'd be delighted to do that. I just want to make sure I have the right people involved in that.
Okay. But you are the person in charge of making these decisions?
This is the team effort, and they're, you know.
But you're the main
Yes,
person.
Yes, sir. And I'll organize the follow-up, but I just want to make sure that the other team members that should be at the table from the interagency are there for that discussion.
Certainly will follow on
I
the two
appreciate
questions I asked.
Thank
At this time, I would like to recognize the ranking member, the gentleman from Pennsylvania, Mr. Dent, for questions.
Thank you, Mr. Chairman. And at this time, I'm going to yield time to my friend and colleague, Mr. Souder, from Indiana.
Distinguished ranking member, I have a 11 o'clock meeting that I have to go to, so
Yes.
I had a few comments I wanted to make, and possibly at the end there are a couple questions that maybe you could send back to the written record. They're more general. I have a number of direct interests. One, in Indiana, not in my district, we have one of the outstanding training potential facilities that the Guard uses, a former state hospital and training center, Muscatatuck, right near Camp Atterbury, that hopefully the Department of Homeland Security will use. The Guard has been using it. General Umbarger has been pushing it. The exercises have been occurring down there are early status. But I've seen different training facilities around the United States, and it is one of the only places that has multiple decade type buildings of 1 to 5 stories, a power plant, underground tunnels, water systems, and it is ideally suited for diverse type of training, and right now the military is using it more extensively than Homeland Security, but because it's a mini city compound in a rural area, it's a great place for training exercises. Also, in general, my hometown of Fort Wayne, the state and the city have done a more kind of mini regional. You're going to have the Chicago, Detroit, and then the question is how are we going to train local fire, police, as we get kind of the second and third tier type areas, and I hope that's in the planning, even though I understand the priority has to be at the highest target areas. Eventually the terrorists are going to move around, copycats, and we need to have all sorts of training. The third thing that's unique to my particular area that I have an interest in and will continue to work with in emergency responses, we've become the center of much of the defense electronics command and control systems, and one of the huge problems in emergency response is people can't talk to each other. Raytheon Command and Control Systems is as a huge division that does this for interoperability of defense agencies. ITT, CENGARs are in my district that we've worked with the Guard to develop. Command and Control Systems was generated by a former Magnavox Raytheon employee that's now General Dynamics Center on this. The person who founded that has formed Sentry, who's trying to put this in for forest fires, because we have people coming in for forest fires and they can't talk to each other and they have to go down, and this happened in Katrina, and looking at how we do command and control systems, because you can run the exercises, but if they can't talk to each other, it's not going to do a whole lot of good. And I would like to know where we're at in command and control systems, how we can further that, and that you don't all have to have the same radio, but you have to have some mechanism for the radios to talk to each other. Another problem that we ran into in Katrina was energy supplies for people moving in and once they get there. The Indiana Guard, when they went down, basically had to take several days in planning, or they would have liquidated the oil and the gasoline stations all the way from Indiana to Katrina. And trying to figure out how we move large groups of people has hopefully been involved in training and preparation as well, particularly the larger the response, the type, where they're coming from. A second thing is most of the people who got to the ground, because it took regional guard, other than those close, quite a while to get there, were volunteer organizations. And one of the things they had was no energy on the ground. That one of the leading people in my district who had worked with an energy company is they were looking at whether you could use corn and ethanol, but he's working towards another, and one of the, where they could burn some of the debris and other things into self-generating energy, because it doesn't do any good to simulate exercises that require energy if there's no energy where the disaster occurred, just like the ability to do radios. And I hope that we're thinking in those terms too, and on the exercising, that you're putting those kind of variations in, that you may not have adequate energy, which leads to a challenge of, are the exercises and the minimal, I haven't seen a top off, but the minimal thing is, how do you simulate real speed? This is Notre Dame's problem in practice. I mean, they can block but they can't seem to do it in a game right now. That are there things that we can do in incentives? Are there financial rewards to individuals? Does it go into their record? Are there things that we can put an urgency in? How do we do real time is a huge challenge of feeling the same pressures one last thing that I raise a lot in Homeland Security and Defense is the younger people are farther on video gaming than and how computers work than much of our government. And we ought to take advantage of this. Many of the military guys I talk to, that what they're seeing, they're doing more on video games, and some of the simulations, they're farther advanced than what we have in our gaming. I mean, my son, when he goes online, he's doing radio communications, in effect, through his ear with people all over the country on his team and the other team, and they're calling to each other, the strategies that they're using. When I went through one simulation and then talked to, I said, look, my 12-year-old son's doing more advanced than what we're doing some in this simulation. Partly, I think some of the command structure is not as up to date in some of the computer simulation things as our kids are. And that's a huge challenge and an opportunity, by the way, too. So I wanted to raise those questions today and look forward to continue to work with you, and particularly thank the Guard, because you've been leaders in Indiana, and I appreciate your leadership.
Thank you. And my time's up, I guess. Yeah, I'll leave it back.
Thank you. The chair will now recognize other members for questions they may wish to ask the witnesses. In accordance with our committee rules and practice, I will recognize members who were present at the start of the hearing based on seniority of the subcommittee, alternating between the majority and the minority. Those members coming in later will be recognized in the order of the arrival. At this time, I will recognize for 5 minutes, the gentleman from Mississippi, the chairman of the committee, Mr. Thompson.
Thank you very much. I kind of came in a little late, but if I can...
Whatever you want to do, Mr. Chairman.
Thank you. Let me thank you and the ranking member for the hearing and the witnesses. Mr. Schrader, there's a memo from the U.S. Department of Homeland Security, FEMA, that defines the National Exercise Program. It says the National Exercise Program provides a framework for prioritizing and coordinating federal exercise activities without replacing any individual department or agency exercise. The NEP enables federal, state, and local department and agencies to align their exercise programs to U.S. government-wide priorities by issuing annual NEP exercise planning guidance. And it goes on. We had an exercise in 2005. Have we shared that document with anybody 2 years later?
Yes, sir. There was an executive summary that was put out to our partners and is available. And we've just recently shared the report with committee staff.
Now, are you talking about the complete report,
The complete report.
Or the redacted report?
The complete report is my understanding, sir.
When did we get it? All right. Is there a reason why it took 2 years to get the report?
Well, sir, the reality is, let me start by saying that we don't intend to make the report public by sharing it with the committee. The intention here, as was mentioned earlier, having the complete report is a very sensitive document. And
Okay, well, I don't want to get into that then.
Yeah.
How are we going to share it with our state and local?
the way the idea there is to take the lessons learned generically and begin to put those on systems like that. We have a lessons learned information system that is widely available to state and local government, and that is available online and has been around for a couple of years.
So what you're saying is we have the exercise, and whatever results from no exercise, we just put online.
We put it out in a format where specific lessons learned by category can be used by state and local government for specific. So, for example, say I'm interested in a particular state in how to do contraflow planning. The idea would be you'd go online and you'd be able to get information from other exercises for best practices.
How much of the information that we did from the top off in 2005 have we actually put online?
My understanding is that we are in the process of putting that information online, but it's not in a format broken out as top off 5, is the way it's been explained.
So your answer is
top off 3. I'm sorry. Excuse me.
So your answer is none of it.
Now let me think about that for a second. It's my understanding that we are putting that information online, but not in a format that is recognizable as top off 3.
Well, if our witness from New Jersey, who represents state government, was interested, then it would not be available to him at this point.
Well, for example, if one was interested in how to deal with response to plague, the intent would be for that to be available online.
Well, not to cut you off.
Yes, sir.
I want to impress upon you that if we invest millions of dollars in these exercises, then if it's 2 years and beyond before the results of those exercises are available to the public, I'm just wondering how much of that information that you glean is actually current enough to move forward with.
If I might explain, sir, and what you said was critical. The executive summary of the document all the way back, let's see, to July of '05 was available for our federal, state, and local partners who participated, and we did share that with those folks 2 months after the actual event.
Okay.
But it was not made available to the public. That's
Right.
the differentiation.
So
sir.
if we take the state and locals who participated,
Yes, sir.
what about the state and locals who didn't?
That is the purpose, and the reason the National Exercise Program created this corrective action plan is that it makes a lot of sense to take those lessons learned and put them in a format that's available for everybody, that's a part of the state and local community that needs it. So that is we believe that is exactly what needs to get done.
Well, I guess, and I appreciate the indulgence of the chair, my real concern is that 2 years after the top-off, we've not publicly shared any of the results of the top-off with any of the stakeholders other than, according to your testimony, those who participated in the actual exercise. And I would venture to say that that's less than 1% of the stakeholders in this country. And so what we need is the ability to not only conduct the top-offs, because we invest the money, but we need people like the National Guard and others who are stakeholders to share in the results of them so that if emergencies come, we would have some demonstrated action to take. But I think I made my point, and I appreciate your answers.
Yes, sir. Thank you.
Thank you, Mr. Chairman. At this time, still continuing the alternate between majority and minority. I will recognize Mr. Dent. I was going to recognize Ms. Saunders. I'll recognize Mr. Dent, and then we'll go to Mr. Dix from the state of Washington.
Thank you, Mr. Chairman. In follow-up to Chairman Thompson's questions, obviously this top-off 3 report was released to a very limited audience. And I guess the follow-up question I would have, Mr. Schrader, would be, what changes are we going to make as we move forward on top-off 4? Obviously, I understand the security concerns about releasing the full report that you just identified, but how are we going to make this better for top-off 4 to ensure more timely reporting?
Yes, sir.
As we move forward?
The intention going forward after this top-off is to to move this exercise process out into the regions of the country, to get more benefit from the process. So, for example, we have our FEMA regional administrators who are now actively involved with us in this program, given that the program is now inside FEMA. And we want, the FEMA regional administrators will be getting resources to coordinate these efforts with the state. The intention will be, as you know, as I mentioned earlier, during this cycle of exercise planning and activities, we want those to be done with, regardless of where the venue is, we want it to be more national in character. Because if you think about it, if you do 2 states every 2 years, it'll take us 50 years to get through the entire country. We need to move faster, quicker, and we believe that by using the regions, as you all envisioned in the Post-Katrina Act, we're going to be able to be more effective. And there's a lot of work. I'll be very candid with you. There's a lot of work to do to make that happen, but that's our intention.
Mr. Langenbach, you know, with respect to the after-action reports for Top-Off 3, do you feel that you have received adequate feedback and information from that exercise of Top-Off 3? Do you? I mean, I think we all realize that the beauty of these Top-Off exercises is not just conducting the exercise, but really the need to improve and, you know, what we can do better. Have you felt, New Jersey, that you've received adequate information from the department?
Well, yes, sir, Mr. Dent. And I guess one of the things I didn't read into the, you know, when I did my summary was that we conducted an internal exercise evaluation. So we put all the moving parts of Top-Off in partnership with our DHS folks and captured all that information, and we called it out and made an after-action report for the state of New Jersey. Again, I didn't get a chance. It's in my written testimony. Some of the improvement actions we made based on that. At the ground level, at the state level, interacting with our federal partners at the state level, I think we've made some great improvements.
So you feel that you've received adequate feedback to help you improve your process?
Yes, sir.
Based on that exercise. Okay, that's good to hear. I guess back to Mr. Schrader. Do you think that that this report will be more available to non-participating states from Top-Off 3? I mean, obviously New Jersey and Connecticut are the 2 states, and it seems, at least in the case of New Jersey, that they seem to be pleased with the feedback they've received. How are we going to deal with non-participating states?
Well, my sense is that we've got to do 2 things, and based on the conversations we've been having, we want to take this executive summary and make sure that we make that more widely available to the stakeholders in the states, of course, again, without having public distribution. And then, of course, the intention is for this lessons learned system to really be a tool for anybody that's in this business in the country, because it'll have a hierarchical access to get to the information, to be able to get that information to the other stakeholders in state and local government.
Thank you. And to General Saunders, I understand DOD will be conducting its own exercise called Vigilant Shield, concurrent with the Top-Off 4 exercise. Could you kind of tell me how these 2 exercises are going to be coordinated, and then why would the DOD conduct its own separate exercise using the same scenario rather than participate in Top-Off 4?
First of all, sir, Vigilant Shield is actually operated by Northern Command, and I don't mean to defer to somebody else, but I can't really speak to Vigilant Shield in detail. What I can tell you is that the coordination, our folks have been working with both DHS and Northern Command to work through the issues of coordination pre-exercise. And the other thing I'd like to say is that exercises, whether you're at the local level, at the state level, National Guard unit level, federal level, are done for a variety of different reasons. I think most of the members of the committee would understand. My understanding of how Northern Command does it is to proof some of their proofs of concept and to do some other things. Traditionally, we do exercises to validate training that's been conducted. So when the National Guard, when I say to you a National Guard Vigilant Guard exercise in conjunction with Vigilant Shield, it is entirely likely that General Renuart and his staff out at Northern Command have one set of exercise objectives that are not the same as ours, because we're exercising at different levels for different reasons, and trying to leverage the resources for both through one exercise. My guess would be that that's what they're trying to attempt to do here. I can say with certainty that's what we try to do with Guam and Arizona and Oregon and the participating states in both sides of that. Hope that made sense to you, sir, but that's kind of the response that I'd give you at this stage.
Do you agree, Mr. Schrader?
Yeah, and if I might add some flavor to that, when I was in Maryland, this is actually a terrific effort, because one of the things that was very difficult at the state level is when different federal agencies are planning exercises and they don't even know that they exist. What we've now, and as I said in my testimony, this is a work in progress, but now we're at least getting situational awareness of all of the plans, and then folks are saying, well, we'll sign up to do that. And we actually did that in Maryland, where if we had to have a port exercise and we were having another exercise, we would combine the two and to allow you to achieve the objectives, as the general would say, for the specific purpose, but only have one effort, so you're conserving resources.
Sir, if I could just piggyback one time onto that and give some credence to DHS's plan for the National Exercise Program that you all have requested and that they're attempting to execute. This is, I think, the cusp of when, as a nation, responders at all levels will understand if we can get a stake in the sand on that national level exercise, the exercises in Tier 2, 3, and 4 that need to nest to those, we have a much better opportunity to do that as we move forward.
Well, thank you, and I'll yield back. Mr. Chairman, I just suggest that maybe we talk to some folks at Northern Command about what they're doing with Vigilant Shield. Thank you. Yield back.
Yes, sir. Thank you. At this time, Chair recognizes for 5 minutes the gentleman from Washington, Mr. Dix.
Mr. Schrader, how long have you been at FEMA?
About 45 plus days, sir.
Well, I mean, now I understand a little bit. You seem to be, referring to other people and this and that. Secretary Ridge, said in an AP article going back to this subject, Ridge, who launched his own security consulting firm on Monday, said he's a big fan of the top-off exercises, but he says it's not acceptable that the review from the 2005 exercise is still not released publicly. Now, I still don't have, in my mind, a clear answer about why. You said that it's because it's so sensitive. Is it so sensitive because there was a lot of failures in this exercise? Katrina wasn't exactly a home run. I mean, there's going to be some suspicion here that if you're not putting out the report, it's because it makes the department look bad, or you're trying to cover up what happened. Mm-hmm. Now, can you explain again why the sensitivity? We're used to having classified reports up here, mm-hmm. and non-classified reports. I mean, why did it take the department so long? Was that the reason they brought you in? Is to try to get these reports accomplished? Or is there just a disregard for the requirement to have a report?
Well, it's my understanding, sir, that going back, the top-off reports themselves in the series, going back to the original one, have not been released as a matter of practice. So I believe that the prior top-offs...
Not even to the committees of Congress?
Well, I can't speak to that.
Until there's a hearing, and then a few days before the hearing, all of a sudden, magically, the report shows up?
I can't speak to that, sir, but my point is...
Why can't you?
I'm sorry, sir?
Why can't you speak to that? Why was the decision made to send the report up on, September 10th?
What I was going to say is I'm not prepared to speak to it today, but I'd be delighted to follow up.
When are you going to be prepared to speak to it?
Well... Let me see if I can back up a step. The bottom line is that it's not the intent to release these reports because of their sensitivity, but...
What sensitivity? What do you mean by sensitivity?
Well, there's in the reports are described the vulnerabilities that were exercised, and the lessons learned from those vulnerabilities are contained within the report. The executive summary, and as I mentioned earlier, the lessons learned are digested and shared. So the intention is to distill from the reports the information that's needed to do the improvement planning.
Has there been a formal lessons learned on Katrina?
Yes, sir. Several. The Congress did one. The Homeland Security Council did one, which had 125 lessons learned. Many of those lessons learned were built into Post-Katrina Act, which was passed by the Congress in October of 2006. Yes, sir.
But so you're saying there's never going to be, has there ever been a thought of having a classified version of this report
Well,
that could be sent to the Congress? That would be able to describe the sensitivities that you're talking about, and we keep things in, you know, secure rooms up here all the time.
The report itself is for official use only, which is unclassified. One of the things we want to avoid is by classifying it then becomes more difficult to boil down and share, which we don't want to do because our state and local partners need to have access to this information.
General, do you do reports on your exercises?
Yes, sir. I think maybe one of the distinctions, and we tend to use, at least so far I've heard today, that we're kind of using after-action review, lessons learned in kind of the same language, and we treat those as two separate things. The after-action review happening, as suggested, immediately after the event. We do a second level product that comes out to the participants very quickly, and then we do a more thoughtful product that's due out within about 45 days of the exercise that goes to all participants. And incidentally, most of that is also hung on the lessons learned information system that DHS operates now. So I guess the answer to your question would be yes, sir, we do it basically at 3 different levels.
Yeah. How do you do it at the state level, Mr. Langenbach?
Oh, I'm sorry, sir.
Pretty much the same way as the general outlined. After we conduct an exercise, we do a quick look at a hot wash, where we bring the players right in and talk to them then. Then we conduct an after-action review meeting, bring all the players and the participants and everybody together, and go through, again, a more detailed look at it. We publish a report. That report's vetted through all the participants in the exercise, and then after that's done, we have an improvement action plan conference, where now we...
Do you leave things out because of sensitivity? You have sensitivity in your reports.
Yes, sir. And I guess what I was going to say is the tail end of everything is that we come out with the best practices recommendation based on the improvement action plan. So we can, if I use an example, when we exercise our hospitals, we have 84 hospitals in New Jersey. We don't exercise them all at one time. We might do an exercise series involving a regional set of hospitals, maybe 5 or 10 hospitals at the most. But what we glean from that exercise is when we come down to it and distill it is an improvement action plan and a best practices recommendation that can go across the state.
Sir,
You said you're short on resources. I happen to be on the Defense Subcommittee. How much are you short?
Sir, when we execute Vigilant Guard, it's about $7 million a year to get participation. Effective with 2008's budget year and through the fiscal budget, through the FIDEP through 13, we have money to plan those exercises at the national level with NORTHCOM as the executive agent for that. And in fact, National Guard Bureau is resourcing about 17 folks out there to work the Vigilant Guard exercise program. That part of the resourcing is pretty well in hand now. The problem is if we go to an adjutant general in pick a state and ask them to participate, that's extra man days for those folks that participate at the leadership level, all the way down, if you do a full-scale exercise, to the responders that show up on the ground to do the exercise. They have to come up with that money somewhere, and right now that's the delta that we are struggling with. So to give you a precise number, rough order of magnitude would be about $7 million if we consider that we're doing the same thing that we've been doing in the past. But depending upon the scale of the exercise would depend upon would set the budget requirements, sir.
I'll yield to the lady here if you'd like to make that comment.
Thank you. I just wanted to say that when General Blum was here, I think he gave us a pretty thorough assessment of their lack of resources and what their needs were.
Well, we appreciate what the National Guard did in the Katrina thing, and you know that whole relationship between how the FEMA works and the National Guard is tenuous at best and needs to be rethought, I think. Anyway, thank you, Mr. Chairman.
Yes, sir. Mr. Dix, at this time, Chair will recognize for 5 minutes the gentlewoman from the U.S. Virgin Islands, Ms. Christensen.
Thank you, Mr. Chairman. Mr. Schrader, two quick questions. One, am I to understand, though, that despite the fact it hasn't been shared, the reports haven't been shared publicly or with us until recently, that the state and local agencies that participate have gotten that report and have been able to?
They haven't gotten the full report. They got a summary in 2 months after the exercise.
Enough information for them
Yes.
to address the deficiencies?
Yes, it addressed the various immediate actions that were obvious going through the exercise, and it was in enough detail that they can start doing corrective action improvement planning immediately.
And the $25 million that you, 25 million?
Yes, ma'am.
That you quoted, does that include what the states put in, or is that just federal?
The
federal
states,
side?
yeah, the states and territories that are participating put about $2 million each in, and that was a competitive process.
Is that included in the 25 million that
No,
you
ma'am.
quoted?
No, ma'am.
I'm glad you said territories, because my next question to you and to Major General Saunders was, is it your understanding that when it says state, it also includes territories?
Right, 56 states and territories, yes, ma'am.
Okay, because in your references before, it was just said state, and I had really wanted to have territories specifically stated in the definition, but it was said to me that state meant state and territories, and I wanted to be sure of that.
Yes.
I spoke to my VITEMA director earlier, and they have hired a consultant to help them plan their exercises. Is that normal, or should we expect that the NEP would help us to do that and not have us to spend additional funds to hire a consultant?
Exercise design is a skill that is, there's a skill and an art to it. Each organization or jurisdiction should have a certain number of people that are skilled and understand how to plan and manage and how exercises are designed. However, because of the episodic nature of exercise design, it's not uncommon to hire consultants, but I would never just turn it over to them. That you need to have enough people of your own involved in the process so that they can guide it.
You're new to the job. Would you just when you go back to your office, would you check to see that there's been some interaction with the Virgin Islands on design and
Yes, ma'am.
planning?
Sure.
Thank you. We had a hearing, I guess it was last week, where we were talking about the use of volunteers, and the concern was that many of the volunteers that came to respond to 9/11 and even in Katrina, that needed follow-up, medical assessments and follow-up, were sort of lost. No one really had identified whose role it was, whose responsibility it was to keep track of those volunteers, to list them, to make sure that we had their contact information. I'm going to ask you and Mr. Langenbach, whose responsibility is it in a disaster? Where does that fall to receive the volunteers and keep an accurate list of those volunteers so that they can be reached for follow-up?
If I may ask, mention something that would help clarify that. In my experience in Maryland, we had 200-plus people go down to Katrina, and we had our medical volunteer corps. Are those the kind of folks you're talking about, ma'am?
anyone, or it might have been firefighters in 9/11 that came from
Right.
other areas that
Yeah, the
never got.
way the system should work is that they're in a mutual aid situation, and in my personal experience and what I know about the system is that there's an emergency management compact between the states, and we would get a tasking from the compact and that we would respond to. The people
But that's just in the region, right? Because
no, it could be anywhere in the United States.
okay.
Yeah, it's
So
all.
all states would have that?
All states are
And
part
territories?
Of, territories are part of the compact. I'd have to check on all territories. I know all states are part of the compact. I would have to check on that.
We probably are.
Yeah, but the point is that we sent our people as part of that request, and it was our responsibility to keep track of them. It was our responsibility for to make sure they were credentialed. Well, for example, the medical people we sent down, we actually swore them into our Maryland Defense Force so that they were covered when they went down. So the actual people themselves and the accountability for those people should be, in my experience, the responsibility of the supplying agency, which would be the state or local jurisdiction sending them. Having said that, part of what the National Incident Management System envisions, and this is where we've got to get to, is a more capable credentialing process at the point of the situation. So it's a two-prong. I'd say the states and local jurisdictions are probably doing this well and know who they're sending and should follow up and track them. But we also need to have a better process of managing those resources when they're coming.
Mr. Chairman, can Mr. Langenbach answer also? Thank you.
Just a couple things. I guess I'm going to bounce back and forth between exercise world and real world, and I'll start with the real world. We also sent volunteers to Louisiana for Katrina, and we did it under the incident management system. So we put a team together, and part of that team we sent a medical team down to work with those folks. We kept track of who was down there, how long they were there, anything that they were exposed to, injuries, things like that happened. Yes, ma'am. And then when we got them back in state, we've kept monitoring them to make sure if some people had developed some, different things, exposure, what they were exposed to down in Mississippi. And we had 700 plus volunteers. On the exercise world side, we learned something during T3, top-off, that the federal government has this lean forward posture. When things are happening, they lean forward. They start pushing assets to the affected state. Well, one of the things we learned was that was going to happen, that they were going to push things to New Jersey as, anticipating what our needs are going to be. And one of those things would be people, doctors, nurses, medical, whatever the medical facilities and things like that. But we had never considered that was going to happen. So now as part of this after-action plan and development, we've already laid out an area, places where when this does happen and, when we anticipate it happening, we'll have a place for them to go and stay. And again, a method to track their whereabouts. Thank you.
Yes. At this time, I recognize for 5 minutes the gentleman from North Carolina, Mr. Eldridge.
Thank you, Mr. Chairman, and thank you for being here, and I apologize for being in and out. I just happen to have another hearing going on at the same time, bouncing back and forth. I know there are many parts to an emergency exercise and tabletop, and I recognize that I participated in one. But having been a former chief state school officer, I've been concerned about the department's failure to fully consider children and the emergency planning needs of schools and their operations. Schools are an important part. A lot of people tend to be congregated there. So as you know, the House passed the Homeland Security Authorization Act earlier that calls for DHS for an undersecretary for policy who would be responsible for considering the needs of children in departmental policy, programs, and activities. And although the responsibility is not yet in statute, I would expect that FEMA is interested in safeguarding all of our citizens, to include children who are among the most vulnerable. So my question is this month's tabletop exercise will simulate a radiation attack disaster. And my question is, how are children incorporated in this exercise, and will the exercise simulate evacuation of schools. And finally, when you utilize medical response in a drill, do you simulate the adaptation of needs for children in terms of equipment and or medication? And as you know, for example, when you're talking about potassium iodide, it's used in response to radiological attacks that protect for thyroid functions. You certainly can't give a child an adult pill, or at least you shouldn't. So my question is, have we done this kind of planning? And if not, why?
I can, sir, I'm not prepared to answer that question, but I can get back to you. We'll have to go back and take a look at what level of detail, but that's a level of detail I don't.
Well, that's a very simple question. I mean, if you've done the planning, we ought to. We couldn't answer the $25 million question. We ought to be answering a $10 question.
Yes, sir.
And that's a pretty simple one.
Okay.
And if we haven't done that, the details of planning, in my view, I mean, I don't mean to be overly critical, but it seems to me if we haven't done that kind of planning, we're way off the map. But I would appreciate a response, not just to me, but every member of this committee ought to be getting that.
Yes, sir.
Thank you. Anyone else want to take a shot at that?
I guess just, sir, from the state perspective, it's something that we wrestle with all the time with our exercises. It's, you know, and you brought up KI, the potassium iodide. That's part of our radiological emergency response planning. And in those exercises, that's one of the things that we talk about is these children that are in daycare centers, children that are in schools, and we're going to evacuate one of these emergency planning zones. Do we give them the KI as they're getting on the school bus to leave, or do we give it when they get to the reception center? We have taken steps, and I know through the national NRC, whatever NRC, I'm sorry, but through the NRC to get liquid KI now for the little children. We've always had the adult size, the 130 milligram, the 65 milligram for the adolescents. Now we have liquid KI, and I know all the states have this. Again, to make it easier to give people, you know, the little children the KI because they're the most susceptible, and also people that can't tolerate medicine. So, Nuclear Regulatory Commission, I knew I'd get it.
Sir, you, sir. From the National Guard perspective, I'd just throw in a couple of observations because I'm also a citizen soldier when I'm not wearing a uniform.
I understand.
I live in Iowa and we do a bunch of different things, but it would seem to me that if top-off is oriented toward the strategic policy level, that perhaps, you know, at the local level you'll see those first responders and the state level healthcare folks taking those aspects on as either a part of a Tier 2 or definitely a central piece of a Tier 3 level exercise. We saw some of that in the Indiana exercise last summer because we were playing from the middle of, actually the northeast corner of Indiana with a nuclear device, and schools, hospitals, you know, people in hotels, all of those kind of special needs folks that may fall through the cracks otherwise became an issue. So from my perspective, we do look at those, but perhaps not at the top-off 4 level type of objective.
I look forward to the response, because I think these are the kinds of things that somebody needs to have on their sheet. Yes, sir.
Just one more point, just to amplify what the General said, was that, you know, the top-off exercise was at one level. It was, you know, federal agency to federal agency, federal agency to state. And then when we brought it down to our level, we took the overarching goals that DHS had crafted for the top-off exercise and created 13 or 14 of our own state goals. And those were, you know, then we got down, now we're down into the weeds. Now we're down into the municipal level and even lower, you know, the individual responder level. So I think that's what's going to happen. I mean, I can't speak for T4, but I'm guessing that's what's happening in the venues at T4.
Mr. Chairman, with your indulgence, I couldn't agree more, but the bigger issue is, have we got a plan somewhere to do it? And if it should happen, do we have the resources and the stuff behind it to meet the needs that are necessary at whatever level we're doing, whether it be at federal, state, or local level?
Well, I can't speak for others, but the state of New Jersey does. Yes, sir.
I yield back. Thank you, Mr. Chairman.
All right, at this time, we'll go with a second round of questions that we might have. I'll yield my time to Mr. Dix from the state of Washington.
Let me thank you, Mr. Chairman. According to a brief summary of the 2005 exercise, Mark for official use only, but obtained by Associated Press. Problems arose when officials realized the federal government's law for providing assistance does not cover biological incidents. Are you aware of this, Mr. Schrader?
Am I aware of the fact that it does not?
Yes.
Yes, sir.
Okay. What are you doing to get that changed? Have you asked, is the administration asked the Congress to change the law or done anything administratively to change the law?
Well, I'd have to go back and see whether there's specifically.
Is there anybody here in your brain trust standing behind you there that can answer the question?
Probably not, sir.
Well,
We'd have to go back. What I'm not clear on, again, this is a.
okay, let me go a little further in
article. I'd
detail.
have
The
to go-
exercise involved a mustard gas attack from an improvised explosive device in Connecticut and release of the pneumonic plague in New Jersey. This caused certain federal disaster programs to be unavailable to some residents suffering from the attack, according to the summary. Now, this is in your summary,
Yes.
and you haven't done anything about it? I know you've only been here 45 days, but do you have any idea if anything has been done about this?
Sir, I don't know, but I will find out. But let me also mention that in the context, I'd have to go back and look specifically at those items, because the bottom line is that CDC and when I was in Maryland, we had programs that we worked with HHS.
I think they're talking about programs to help citizens who are affected by this, and apparently the federal law doesn't cover this.
And what I was gonna say.
I think maybe our committee might even have jurisdiction, so we might be very interested. If you don't have, we might be able to fix this for you.
Right, and if we're talking about the Stafford Act, that becomes definitely the Stafford Act does not cover this, and so that would be where the issue is.
A 2005 Homeland Security Inspector General report suggested the department start tracking the lessons learned from these exercises, and apparently you're doing that. Is that not correct?
Sir.
Okay.
Yes, sir.
A 2006 White House report on Hurricane Katrina criticized the department for not having a system to address and fix the problems discovered in the top-off exercises. The most recent top officials exercise in 2005 revealed the federal government's lack of progress in addressing a number of preparedness deficiencies, many of which had been identified in previous exercises, according to the White House. Now, you know, the White House isn't your enemy here. I mean, this is, you're part of this administration.
Yes, sir.
Previously, a more detailed version of lessons learned from Top Op 2, held in 2003, was not released to states for security reasons. So, so this seems to be an ongoing problem. I mean, the whole purpose of lessons learned, I can remember General Schwarzkopf coming back from Desert Storm, Desert Shield. He came before our committee and told us all the things that were problems. And we went and we fixed a number of those things. We got UAVs and other things because we couldn't see over the horizon. There were a series of things in intelligence that General Schwarzkopf wanted fixed, and he came to the committee and we got them fixed for him. Well, I think that's the way it should work here. If you find out that that the law is limiting you, and you've only been here 45 days, but the department should have been doing this, and apparently they're not. And that's why there's suspicion up here about is anybody in charge down there?
Right. Could I offer, sir, that I would not assume, because I'm unaware of it at this moment, that the department's not doing it, number one. Number two, the National Exercise Program actually, the way it's designed now, addresses many of these issues that were discussed in this article. Starting with the Homeland.
But some of them have to change the law. The article can't change the law.
Well, right.
Only the Congress
Yes,
can
sir.
change the law.
Yeah, in that particular case, yes, sir.
Well, could you get us a report? Could you get us a piece of paper on these exercises, the things that may need legal changes, and submit it to the committee, Mr. Chairman? I think that would be totally appropriate. We'd like to help you
Yes, sir.
I know it may not sound like it today, but we're just trying to get the information out here so that we can correct some of these problems.
Right.
And the sooner the better. Thank you, Mr. Chairman.
Yes, sir. At this time, recognize for 5 minutes the ranking member from Pennsylvania, Mr. Dent.
Just to Mr. Langenbach, just a quick question. Since you participated in Top Off 3, what are the main changes that you would suggest to the overall Top Off exercise program?
Well, that's a great question, sir. One of the things that we saw during the top-off exercise, and I think it's exercises in general, is time. We crammed, and I'm using crammed in, I don't know, the positive sense, an awful lot of activities into 5 days of exercise play, perhaps unrealistically. Some things would have flowed. I mean, if we look at real-world events, we've been telling people at the local and state level that you're going to be on your own for 36 hours or whatever. But we, in the exercise world, try to accomplish as much of interaction either between the locals and the counties and the state, and then the state to the federal government. We try to accomplish all that in 4 or 5 days. It's unrealistic. I think if I could, and really this is, I'm going to get hurt when I get home for this, but I think the exercises should be longer. They should be 10 days, 2 weeks. We've tried that at some extent at home, but it's, again, logistically, think about it. What we went through logistically in 5 days, if you double that or even longer, it's a challenge. From a number of different standpoints. To get to play in an exercise, to get people to play in an exercise for 5 days is a challenge. And we had our governor fully involved. We had our governor's cabinet fully involved. You could see at the end of the exercise play, Friday afternoon, people are starting to tail off. Things are starting to tail off. So again, it's another challenge. If I could change something, sir, that would be it.
You just extend the exercise.
Yes, sir, and make it more, again, realistic time-wise. Thank you.
Thanks for that answer. It's helpful. And to General Saunders, just quickly again, could you just explain the role of the National Guard in Top Off 4, what it will be versus that of Vigilant Shield, so I understand this better?
Yes, sir. I'm sorry I wasn't quite as perhaps responsive as I should have been on your first go-around with that. National Guard, with respect to Top Off 4, we have Oregon, a full-scale exercise going on with National Guard work in that particular area. In fact, the National Guard Bureau will send a what we call a joint enabling team, which is supporting staff officers to the state of Oregon to help them in the middle of a crisis do some work. And we really started that in Katrina. We actually started it pre-Katrina, and the states need to request that kind of activity. So Oregon is a full-scale exercise for us. Guam is a full-scale exercise, and we'll be sending some of our public affairs folks out there. Do we need to hold on this, or? So that's part 2 from a National Guard perspective. In Arizona, we have a functional exercise that we are participating in, and then with NORTHCOM, we're not exactly disconnected from that, but we are not actively involved in running the Vigilant Shield side of the program. The National Guard has between 300 and 400 people involved in Top Off 4 in those 3 states that and territory that I mentioned, 2 states and territory. And then we also have our adaptive battle staff back here at NGB at the National Guard Bureau level, working at the strategic federal level. Does that answer your question?
Thank you, and I'll yield back. I'll be happy to yield to Mr. Dix.
You mentioned in your statement the civil support teams. Are they used? Would the Oregon Civil Support Team be involved in this?
Good, I feel better.
I believe they would be, sir. I can't speak to that exactly, but my guess would be they would as a full-scale exercise, and perhaps other states, because the civil support...
Tell us again what the civil support teams do for the National Guard on a state-by-state basis.
Okay, I understand I'm not an expert on civil support teams, but they are 20 to 21 people, both Army and Air, who have capabilities to assess weapons of mass destruction, biological and chemical agents, limited decontamination to decontaminate their own folks, but to provide information about what kind of agent we're dealing with, what kind of radiological agent we're dealing with, to the civil authorities That's civil support to the civil authorities.
Have you found any legal impediments? Are there any, anything that impede the National Guard from doing what's necessary in these areas, like apparently FEMA has?
Well, sir, yes, and in a word, I would say flexibility and funding. One of the things that we thought we were probably going to be asked today was, how is National Guard and DHS working together? What are we doing to collaborate? And I can give you some examples that will be a fairly lengthy answer to your question, but not overly so. And it gets to the flexibility of funding. For example, in the critical infrastructure protection mission assurance area, we have been contacted by DHS, our J3, the operations folks at National Guard Bureau, to field 10 teams nationwide to go out and assist in creating critical infrastructure assessment. That plan originally was to use the Economy Act to flow dollars to us. DOD says they have to go federal agency to federal agency. That's fine. So we're working out the details behind making that happen, and in my judgment, probably should have already been done. On a similar effort, the Constellation ACAMS program, which is a it's a DHS program, automated critical infrastructure asset management system, so that at the local level we can start capturing data about a critical infrastructure. DHS has asked us, the National Guard, to help them train nationwide first responders and emergency managers across the 54 states and territories and the district. And my response to that was, knowing what was going on with the critical infrastructure piece and the discussion about Economy Act, was perhaps DHS can flow the money to 3 states that we help identify, and in lieu of waiting for this policy and regulation change to occur, since the money comes from DHS directly to the state, those states could put soldiers and airmen on state active duty to conduct that training, using Guard facilities where necessary, because we're in 3,400 communities. We would field 3 mobile training teams. So there's 2 examples. Those are taking longer than they should to put on the ground, because we have to work our way through a milieu of Title 32, Chapter 9, Title 32, Section 502, to be able to put folks on duty to do those operational missions. And I understand that the pushback then is not breaking the bank in terms of use of Title 32. So the protections that have been put in place have been there for good logic, but they're hampering us now in terms of being able to partner more effectively with DHS directly.
Well,
in my opinion, sir.
Could you give us a piece of paper that would outline this problem? Maybe we can do something about that as well.
I can't, but I'm sure our legislative liaison folks will be prepared and ready with that. Yes, sir.
Thank you. Thank you for yielding.
Yield back.
All right. Mr. Elledge, any questions?
Very quickly, thank you, Mr. Chairman. We've been talking today, by and large, about top-offs that are dealing with man-made disasters. You know, we're talking also, the agency is all hazard. And don't want us to forget that. My home state happens to be one of those states that's sort of in the bullseye of hurricanes. Right. And we're likely to have as many or more hurricanes, and the greatest catastrophe we've had in recent years happened to come from one in New Orleans. My question is this, though, because in the past we've seen that FEMA hadn't reacted as well as they should when we had natural disasters, and we're still suffering for that in the Gulf area. My question is, with the departure here now of the chronic vacancies we're seeing in DHS and the deputy leaving, I'm concerned about the brain drain that we may be having now at a time when we might have real needs in the build-up of maintaining professionalism. Much of what we've been talking about has been terrorism. So my question is, what gives you confidence that the skills gained in these exercises will transfer to an actual disaster if it is a natural disaster?
Right.
And what follow-up is being done to make the modifications, if we need to make them, from lessons learned to transfer to that? Because I think that's a critical piece.
Yes, sir. Let me see if I can be brief, because that's about a half-hour discussion. But
see if you can get it in about 3 minutes.
Yes, sir. FEMA now is at 95% strength. So under Mr. Paulison's leadership, we have been rapidly ramping up. We've actually gotten additional, thanks to the Congress's intervention, we have new people that are in addition to that we're going to be putting out in our regions. The other thing that we're doing is we're very focused on hiring professionals. Yes, sir. And we're very conscious of hiring career people who are going to take the place. For example, just a very simple example, there's a fellow in my office who was the acting secretary. I've made him my assistant. So even when I leave, he's still there. So there's a lot of focus on continuity and making sure we have career people who are capable to lead the effort. The other reason we're putting so much focus on the regions is we want to put quality people out in the regions to run that. I'll mention one other thing. During Hurricane Dean, which Administrator Paulson has talked at great length about a lot of the changes that have occurred in the last year, we saw an incredible coordination. There were daily VTCs with all the players across the board. We had Northcom and the National Guard Bureau, the state of Texas, the regions, and we tracked that storm 5 days out and pre-positioned resources in a way that we would have completely been prepared. For example, Texas has about 400,000 people along their border with Mexico, and we were actively tracking the requirements for that and had positioned resources to be able to evacuate those people. Now, fortunately, it tracked south, but there was a dramatic difference in the way FEMA is leading this effort in coordination with all the interagency and state and local government. So I have a lot of confidence that we're moving in the right direction, sir.
Thank you, Mr. Chairman. I yield back.
Thank you very much. Since we have a vote to go to, we'll go ahead and close up now. I want to thank all the witnesses for the valuable testimony and the members for the questions. The members might have additional questions for the witnesses, and we'll ask you to turn that back to us. I would ask that you, I'm going to ask the committee clerk to sit down with your committee clerk, also your clerk, also to help us set up the topic for we're going to have a briefing on the questions that I asked, and I think Mr. Dix had some questions, and any additional questions that the ranking member might have.
Chairman Yield?
Yes.
Would we be able to have somebody from Northern Command there maybe as well to talk about their exercise?
Yeah, why don't we go ahead and do that. Now, what I would ask for our clerk is to set this meeting within 10 working days, and if you can provide us some of that information beforehand, we'll do that, so the clerk will be in contact with you. Having no further business, the hearing is now adjourned. Thank you very much.